Good morning, my name is Mark O'Herlihy. I'm the Director of Healthcare for Europe, Middle East and Africa for Perceptive Software. So we do see some trends between international and North America there's some real differences in the vendor-neutral archiving market. The term VNA is something that's used as an industry term. It's really referring to medical imaging archiving and how you consolidate all of these medical images together in one usable storage platform or data management platform is the term for VNA. So in international, we're actually seeing some very big differences around a patient-centric approach to consolidation. The challenge we've had internationally as opposed to North America is we're normally 3 or 4 years behind the curve. So we have to then apply different solutions to these customers. For example, they may be looking for just a migration archive to start with, but because of the patient-centric approach, it's accelerated actually their adoption of much more data management around unstructured information. So that is really driving the need to fix problems and common trends within healthcare. So the common trends we're seeing at the moment are really to do with sort of 3 key areas. We hear a lot about cloud, we hear a lot about big data analytics, and a lot about mobility, the mobile access to information. And the interesting part about this is that the drivers behind that are we have an aging population with multiple chronic conditions and actually a need to increase safety and quality of service. But at the same time, we've got a reciprocal, which is reducing cost. They have resource shortages, and actually they got regulations in countries internationally that really need you to keep data localized. So the 3 things around cloud, big data analytics and mobility are driven out of those needs. If we take cloud first of all, the term cloud is used, as everyone knows, in different ways. There's cloud computing, where you get access to resources. There's actually off-site storage of information. The way we approach cloud is it's really infrastructure on demand. So some of the resource shortages that the hospitals are having, they need to actually outsource maybe a second copy of data. They need to have fast access outside their organization. So really our approach to it is using like a web services approach where we allow them to use the infrastructure as they need to, and we host our own software in that infrastructure to really give them that flexibility around reducing cost, but at the same time having very good access to information on demand. For big data analytics, it's a much bigger challenge. Areas like genomics in healthcare the demand for large information is really not allowing these people to search information because it's too big. It can't actually sit in a normal relationship database that you have today. So you see new technology coming out to meet the needs of big data so that we can not just store it, but we can access it, we can manage it, and we can actually then run some meaningful analytics against that data once it's in the system. And then the third one, mobility. Interestingly, there was a study done in the UK only last year around mobility, and over 50% of organizations that were going to buy an EMR actually said they want to access it via a mobile device. So as much as it's been a concept around mobility, the demand for information at the point of care is driving mobility faster than I think the market can keep up with it. So at Perceptive Software, we're uniquely positioned to manage these challenges around cloud, big data analytics and mobility.